My name is Urson Black, and today I'm going to talk about cerebral palsy. For our first question, we're going to ask, what kind of disease is it? In actuality, CP is a group of neurological disorders that are characterized by impaired motor function. All forms of the disease are non-progressive, meaning that the symptoms don't worsen over time. But what causes this disease? According to the National Library of Medicine, cerebral palsy is caused by damage to either the cerebral cortex, the cerebellum, or the basal ganglia in unborn or newborn children. Depending on the area of the brain that's been damaged, CP will manifest in one of four ways. Spastic CP is the most common form of cerebral palsy and results in increased muscle tone as well as stiff and awkward movement. Spastic CP is a result of damage to the cortex. Dyskinetic CP patients typically present with a lack of motor control in the hands, arms, and feet, which makes sitting and walking difficult. Dyskinetic CP is a result of damage to the basal ganglia. Akinetic or ataxic CP is characterized as an inability to control coordination, which results in further difficulty with fine motor control. Ataxic CP is caused by damage to the cerebellum. The fourth form is simply a mixed manifestation of two or more of these conditions. So what are the treatments for cerebral palsy? Unfortunately, cerebral palsy is not a curable condition, as it is caused by permanent fetal brain trauma. However, it is worth noting that technological and medical advances have drastically improved the survival rates and quality of life for children with the condition. Physical therapy, muscle relaxants, motorized scooters, and wheelchairs are just a few examples of such accommodations. However, patients with extreme symptoms sometimes require corrective muscle surgery. Now, let's talk about the associated conditions that are common in CP patients. Depending on the severity of the initial brain damage, some patients may experience varying levels of impaired eyesight, hearing difficulty, challenges with speaking, as well as seizures and many other patient-specific neurological manifestations. It is worth noting, however, that these conditions are not guaranteed to manifest in all CP patients, nor are they guaranteed to appear at all. Lastly, let's address the statistics. According to the CDC, despite the number of patient deaths dropping in recent years, the birth prevalence of the disease has not gone down, which makes it a very current issue in the medical field. Between the years 1985 and 2002, the ratio of 3 in 1,000 children having the condition has remained roughly the same, making it the most common neuromotor condition in children. Again, my name is Urson Black. Thank you for watching my presentation.